Good morning, students. Today we're going to be looking at chapter 25, personality disorders. And, well, personality disorders may be the most, sometimes it's a little more difficult to understand. So I hope that this will be helpful to you. I'll cover as much as I can in the time allotted. Let me see, it's 10:48, no, 10:49 now. So let's just jump right in. This is chapter 25. Now, what is personality? Well, personality is it's like who you are, what makes you. That's your personality. When people look at you, they see your personality. They see as Freud would say, your ego. Uh, it influences inner experiences and behavior, your personality. Um, it's your self identity. It's, are you a kind person? Are you a patient person? Are you faithful? Are you honest? Are you truthful? So this is your personality. Let's go to the next slide, number 3. Now, what is a personality disorder? Well, a personality disorder is characterized by fixed inner distress or behavioral dysfunction. That you don't function the same way maybe that the normal society functions. So that's what is considered a personality disorder. It's negative characteristics that are not conducive with the societal norms. Um, Theories of causes of personality disorders. So, how does a person get a personality disorder? Um, Pretty much it's kind of unknown as to how this happens, but the theories are that nature or genetics and the environment have a lot to do with your personality. It makes you your personality. It gives you your personality. Also, there is nurture, whether you were neglected, abused, or traumatized during childhood. This definitely has to stems back to inadequate parenting. Maybe your parents didn't take care of you the same way. All right. So those are basically the theorized causes. A combination also of psychosocial and biological. That means like chemical, chemical genetics, the way that you are. That also might prove to be a cause. So manifestations of the symptoms of personality disorder could be number one, cognitive, where and that means that you have a way of thinking about things, of perceiving things, of seeing things, um, and this is the way that you assign meaning to things in the world. You assign meaning to other people, and things that happen to you. For example, it's a personality disorder if when something happens to you, you think that that person did something to you, they're after you, or they did it, not so much that you're hallucinating or delusional, but that you believe that these people kind of are not good people, and they're trying to get you, and it could be from no real reason whatsoever. It could be just something minimal, but yet you would take it this way. Then there's also the affective, how you feel about things. People with personality disorders are either very emotional, very dramatic, and impulsive. They respond sometimes too impulsively and very histrionic at times. They get all bent out of shape. Oh my God, this is, something like that. Okay, and then interpersonal behaviors is very hard for them to carry on. at times a interpersonal relationship. And of course, impulse control, they have problems with that. Okay, so let's go on to slide number 6. Personality disorders are grouped into a cluster. We have, let me just, 10:48. Okay, I'm just checking the time. Clusters. Cluster A represents odd, okay, strange, eccentric kind of behaviors. These people with personality disorders behave a little strange. You're going to be seeing what I'm talking about in a minute. We also have cluster B, very dramatic or emotional. These are very dramatic and emotional uh, 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 personality disorders. And then cluster C are the anxious and fearful personality disorder. Okay? So, cluster A, we have 3 disorders in cluster A. We have paranoid personality disorder, schizoid, and we have schizoid typal. Okay? So I'm going to discuss paranoid personality disorder first. Now, paranoid is basically what it says. These people are kind of suspicious around other people when they can befriend you, but if there's something going on, you say something that's kind of like off, they might take it as being a threat to them, and they think you're after them. They can be guarded, like always on the alert, and they can bear grudges for simple things. So that's paranoid. Schizoid personality disorder. These people, rather, are very indifferent to social interactions. They don't have to have social interactions. It hasn't. Social interactions do nothing for these people, and so they stay away from it. They have very flat affect, which means that they don't smile much. You can't really. They just don't have any expressions. Okay, flat affect. They never married, and they usually live alone. They work very solitary jobs, like maybe a night watchman, something where they don't have to deal with people. So they'll be like a night watchman working during the night, and they usually live with their parents. They're not interested in sex either, so that has nothing. They don't. They don't care about that. All right, so that's schizoid. Then there's schizoid typal personality disorder. These people are very uncomfortable with social interactions, so they stay away from people because they have extreme dislike or discomfort with relationships. They also, maybe you might see somebody like this pushing a shopping cart down the street, and they might be disheveled, dirty clothes or whatever, and they're not schizophrenics, they're schizotypal. Okay, now you might see these people also having odd thoughts and odd behaviors that they do, and speech, and definitely appearance. So they may be suspicious and also of people, and they can believe, rather, some of them do believe that they have telepathic abilities, like a sixth sense, like they can sense things, and they can communicate, clairvoyance, all right. Communicate also that they have clairvoyance. They could see things in different realms, like maybe spiritual realms or whatever, or they can communicate with aliens, okay? And they have odd ways of talking also. It may be vague, their speech. You may not understand too much of what they're saying at sometimes. And they may start talking about aliens coming to the earth, and that they can communicate with aliens from another being, from another planet, rather. Okay, so let's move on. Now, schizoid and schizoid typal, again, we see that there's problems in socialness. Okay, so the schizoid um, doesn't doesn't need to have social interaction. Okay, they don't. That's it. That's basically it. They don't need it. But however, the schizoid typal can't tolerate it. They fear any interactions. Now, the schizotypal, as I said before, they can uh, have delusions of aliens, and they might even hallucinate at times. And you know, I mentioned the delusions of being having telepathic abilities, being able to read either minds or communicate with their minds with other people. So sometimes, so that you don't read their minds, they'll wear like an aluminum hat made out of aluminum foil. Um, Now, they these are, they say, are linked genetically to schizophrenia. So it's almost like schizophrenia, and they have a dopaminergic pathway disorder. Slide number 10, we have cluster B. Now there's four in cluster B, uh, and these mostly are focused on interpersonal conflicts. They have conflicts with other people. The cluster B are very dramatic, emotional, and attention seeking. Their moods can be labile and very shallow. You know, they don't have any depth to them emotionally. Um, and so they, we will see, for example, we're talking about antisocial personalities, borderline personalities, and histrionic personalities. So, antisocial more in men, borderline personality more in women, and histrionic also more in women. And these are usually, you'll find a family history of either one of these, or could be environmental factors and trauma, abuse, and abandonment or childhood adversity. We'll see that these could be causes of that. Slide number 11. So we'll look at antisocial personality disorder. We have now here two disorders, and they're the same, but yet they have differences. So let's look at sociopaths. Sociopaths and also psychopaths have this common denominator. They can display aggression, they could be irresponsible, and they usually have conflicts with societal laws and norms. So they usually might get involved in the judicial system as prisoners, and the criminal justice system. The one thing that, the same thing with sociopaths and psychopaths, is that there's no guilt or empathy. Okay? Now, there's another difference between the two. The sociopath is very impulsive, and they'll go out, commit a crime, and leave fingerprints or whatever. The psychopath, however, which are most serial killers, are very methodical, and they're smart. They'll do everything not to leave evidence, etc., fingerprints. So even though they both have personality disorders, and they have conflicts with societal norms, they are very aggressive. The display of aggression is different, where the sociopath will display his aggression outright, but the psychopath will think about how they can get back at you aggressively. So the psychopath is usually very educated, where the sociopath isn't. And the most important thing is that the psychopath is very methodical and calculated. And so, with the sociopath, we see that they usually get into fights, they lie, they steal, domestic violence, substance abuse, and scams. They get into all of this. You won't see this as much with the psychopath. Uh, it's believed that Bernie Madoff was a psychopath in what he did. And his violence stemmed into his acts. Not that he's violently killed people, but he was psychopathic in nature. All right, so a psychopath and sociopaths both, they could be superficially charming, but really they don't have any emotional connections. Another good point is most sociopaths or anti-personality disorders, you'll find make up 70% of the prison population. So when you look at prisoners, most of them are sociopaths or psychopaths. Cluster B also has borderline personality disorders, very difficult personality disorder to deal with. These patients are very unstable and labile, and they show poor impulse control and decrease interpersonal relationships. They can't really. There's no genuine connection with people. They're unpredictable and angry, very angry behavior. Okay, they most borderlines are females, and it is believed that these females lack validation during childhood. So validating them is very important when you're treating these patients. They believe they're also victims, and that's what they view themselves as, victims. Things have happened to them. They are volatile. They can blow up at any minute. They're void of any true feelings, and they vacillate. They change from one minute to the next, and they can be violent. So there I gave you 6 V's for the borderline personality disorder: validation, victims, volatile, void, vacillating, and violent. Okay, these individuals also can manifest suicidal gestures or threats. Usually what happens is they can cut themselves on their wrists. When you have a borderline, sometimes who is really impulsive, you have to put them on one-to-one watch, because at times they can try to hurt themselves, and they do it for attention, but most borderlines wind up dead because they slash their wrist or whatever, and it's just they want to do it like feigning a suicidal gesture, and they wind up really killing themselves. And they can also try impulsively harm others, not just themselves. Okay? Next one. Histrionic. Histrionic personality disorder is a pattern of excessive emotionality. These are also patients that seek attention. They strive to be the center of attention, and they have no depth, no feeling. Emotionally, these patients are void. They want to just be the center of the conversation, and they might dress provocatively, they might speak provocatively, and again, they're very emotional. And most of this stems from feelings of insecurity, and at times they may be very seductive, trying to seduce you. Women fall into this category a lot, and homosexuals. They're very flamboyant and colorful and wear, colorful clothes, and as soon as something goes wrong, they have a meltdown. And there's a picture in the slides of someone with histrionic personality disorders. Now let's look at the narcissists. Narcissistic personality disorder. These patients are very grandiose, self-centered, and self-absorbed. And again, they have an inability to empathize with people. Most of these disorders in the personality category, majority, all of them, cannot empathize. They don't really feel connected to people. They can't put themselves in other people's shoes. So again, grandiose. They're experts at manipulation. these patients or people, they are could be haughty, arrogant. They think they're like the top dog, and that's basically those people. Maybe you might know someone like this, a family member or whatever. Always wants to be the center of attention and thinks that they're more than what they really are. All right, so now we have the cluster C personality disorders, which are anxious. Um, Also, they could be tense and over controlled. Um, Avoidant personality disorder is the first one in this category. And so this is a pattern beginning in early childhood of social discomfort. They don't like to socialize. They're very timid, shy, and they fear, kind of fearful. Not to a great extent, but most of the time that's what they do. They stay away from people. They think that they're inferior, etc., socially inept, and they avoid jobs that have social demands that they be social with people. Cluster C is another cluster C is the dependent personality disorder, um, and these people are very dependent on another person or people, and they're kind of clingy. You know, they if they see someone that they can depend on, and that person will meet their needs, they'll grab onto that person and they'll kind of hold on to that person. They're also submissive. They'll submit whenever they can. If just as long as you don't leave them, they'll do whatever you want. They need approval for everything that they do, uh, and they find it hard to make their own decisions. The last one in the cluster C is the obsessive compulsive personality disorder. This is not to be confused with OCD, obsessive compulsive disorder. This is OCPD, okay? So it's characterized by perfection. These people, they have their house really, really spotlessly clean. Everything's in its place. You cannot move anything out of place, and do not disrupt their household. They usually dress almost to perfection, and the thing is, they're very rigid, and they control their behavior. Also, they're very controlling in their behavior, and they're extremely orderly. So they have order, and they believe that everyone should be like this. See, that's the thing. The OCD knows that they have a problem, and so they they know it. They have insight to it, and they look for help. The OCPD doesn't think they have a problem. They feel that everybody should be like this. Okay, that rigid imperfection that they're usually preoccupied with. Uh, okay, so that's why, and they like to work a lot. They also can be hoarders, and they let's see what else they're stubborn. They could be stingy, meaning they don't like to spend money. Uh, okay, now moving on. Factors affecting the prognosis. Well, the degree of functional impairment and the client's motivation to change. Does that patient want to change, and how deep is the problem? Okay, usually the goals of treatment for personality disorders are different. For paranoid and avoidance schizoid, you might do problem solving. For narcissists, is coping with their own inadequacies, etc. And so learning coping skills. And with this avoidant, antisocial, learning social skills. And the anxiety disorders, or the dependent OCD, also coping and antisocial, to increase awareness that they are a certain way, and that they have these characteristics, and then help them to change. And help with the borderline and the histrionic. You could help them with the destructive personality traits, and the histrionic and antisocial, they can gain insight. There are also pharmacological means that we could do, like antipsychotics, antidepressants, um, mood stabilizers can work, and basically that's it. And some therapies, maybe cognitive behavioral therapy, etc. Family education, and the assessment part, you could look that up on your own. That's slide 25, 26. You want to control. You want to control risk by providing safety. Okay, and make sure the patient does participate in therapy and improve coping skills. So let's see what else we have. And the implementation, you could read that one on your own. And the client outcomes. And as a nurse, as I mentioned before, personality disorders are very difficult. There are many, these patients are difficult to treat sometimes, but you basically know yourself and know whether you can deal with these people, and if not, then you can get some added help through additional resources, get some support, etc. And just grow personally and professionally on your own. Thank you. I hope this was helpful.